Coming to the next case, a 26-year-old female presented with history of anorexia, constipation, fatigue, poor memory, irritability, sleep disturbance, bilateral symmetrical lower extremities paresthesia with burning pain and muscle cramps. On examination, there was decreased vibratory position sensation, absence of knee and the ankle jerk and muscle atrophy. Her diet consisted of polished rice without pulses, oil seeds, etc. The enzyme transketolase levels in erythrocytes were low. Now, looking at the presenting history of the patient, it is mostly the peripheral nervous system what is involved. And looking at her diet, it is a polished rice, and also there are no pulses which are included in the diet. We know that polished rice lacks the vitamin thiamine, and also the enzyme transketose levels in erythrocytes were low. So all these together indicate the diagnosis towards dry Beri Beri. When I say dry Beri Beri, that means there are different types of Beri Beri. This Beri Beri is mainly due to the deficiency of vitamin B1 or thiamine deficiency. The different types of Beri Beri are dry Beri Beri, wet Beri Beri, and infantile Beri Beri. And there's another one called the Wernicke-Korsakoff syndrome or the cerebral Beri Beri. So dry Beri Beri specially affects the peripheral nervous system, which is seen in this particular case. Wet Beri Beri specially affects the cardiovascular system and other bodily systems. Then infantile affects the babies of malnourished mothers. So now this vitamin B1 is a water-soluble vitamin, which is a sulfur-containing B complex vitamin, which is also known as anti-beriberi factor, anurin, and antinuretic vitamin. The coenzyme form of the thiamine is TPP, that is thiamine pyrophosphate, which is mainly required for the energy releasing reactions in carbohydrate metabolism. When I say the dietary sources of the vitamin B1, it is widely distributed in the plants. Allurone layer of the cereals is a rich source of thiamine. Hence, the polished rice which removes the layer which is most rich in thiamine lacks thiamine whenever we use polished rice in our diet. So, and therefore then whole grain cereals, bran of cereals, nuts, whole wheat flour and unpolished hand pound rice have better nutritive value than the polished refined foods. Animal sources, liver, lean meat, eggs, milk, etc. Coming to the recommended daily elements, adults it is around 1 to 1.5 milligram per day, children it is 0.7 to 1.2 milligram per day, pregnancy and lactation it is 2 milligram per day. Now, what is a biochemical basis for the presentation in this particular case? So I mentioned that it is the peripheral nervous system what is involved, and the biochemical functions of thiamine or the coenzyme thiamine pyrophosphate is mainly connected with the energy releasing reactions in carbohydrate metabolism. The various reactions where the enzymes are dependent on TPP are the PDH complex, that is pyruvate dehydrogenase, which is a multi-enzyme complex, depends on TPP for the conversion of pyruvate to acetyl-CoA, and this acetyl-CoA enters a TCA cycle for the energy releasing reactions. Next enzyme is a alpha-ketoglutarate dehydrogenase, where alpha-ketoglutarate is converted to succinyl-CoA. So here the enzyme alpha-ketoglutarate dehydrogenase again requires TPP for its function. Next enzyme, the transketolase. The TPP is involved in transketolase reaction in the HMP shunt pathway. HMP pathway, as we know, is the sole source for the synthesis of ribose used in synthesis of DNA and the RNA. So these reactions also produce NADPH, which is essential for fatty acid synthesis, cholesterol synthesis, and other pathways. So now correlating the biochemical functions and the presenting symptoms. There is deficiency of thiamine, that is the coenzyme TPP, which ultimately leads to the presenting symptoms or the signs of involving the peripheral nervous system, which ends up as dry beriberi. Coming to the assessment of the case of dry beriberi. Now what happens over here? Deficiency is mainly the vitamin B1 or the thiamine. So we have to look for the serum thiamine levels. So in thiamine deficiency, the blood thiamine levels are decreased, while pyruvate, alpha ketoglutarate and lactate are increased due to lack of thiamine deficiency. Then look for the erythrocyte transketolase levels. Measurement of erythrocyte transketolase activity is done before and after giving TPP. In thiamine deficiency, erythrocyte transketolase activity is decreased and improves after giving TPP. The principle of the assay is that the blood thiamine is oxidized with alkaline potassium ferricyanide to a blue compound, thiochrome, which is estimated fluorometrically. Next, blood estimation can also be done by HPLC method. Coming to the treatment of the case of dry beriberi. So in suspected cases of thiamine deficiency, prompt administration of parenteral thiamine is indicated. The recommended dose is 50 mg given intramuscularly, and the duration of therapy depends on the symptoms, and therapy is indicated until all the symptoms have disappeared. Then we give the maintenance, which is the recommended dose is 2.5 to 5 mg per day orally, unless there is a malabsorption syndrome. That is, whenever there is malabsorption syndrome, oral cannot be absorbed. Hence, again recommended would be parenteral thiamine. So this is about the dry beriberi, which is mainly due to the deficiency of vitamin B1, the coenzyme of vitamin B1 being the TPP, thiamine pyrophosphate.